We've built up a centre where we now see over 800 new cancer patients a year, divided by a number of surgical specialists with a whole oncology team as well. And we get obviously a lot of routine breast cancer work through with reasonably straightforward situations to look after. We also get a lot of women referred in for second opinions, for tertiary surgery, tertiary management. The other thing that we've also built up over the last 10 years is our clinical genetics service. And I think we've got probably the most experience of risk-reducing surgery with breast reconstruction of Europe, certainly one of the biggest. Well, the challenge was to talk about what we might anticipate is going to happen over the next 5 years. And there's no doubt that as genomics and proteomics are becoming more sophisticated, that for individual patients, the path of treatment that we take them get down is becoming more and more focused and more complex, and also much more expensive. And it starts right at the beginning with the diagnosis and the surgery, because certainly the surgery is far more sophisticated than 10 or 12 years ago. The reconstruction options don't stop with total breast reconstruction. We're now using lots of partial reconstruction techniques before radiotherapy. But right the way down through the prediction of who is going to need which drugs, which monoclonals, the testing is expensive, the drugs are expensive, and yet we're sure by doing that we're going to impact on lives, we're going to give high quality life, hopefully we're going to cure more patients. But with that expense, I think also comes the challenge that we have to try and reduce the burden of breast cancer in society. And so I was looking at various country budgets and what they do with those budgets. I was talking about comparisons between primary management of patients across countries. Even in Europe, there's a huge variation. The mastectomy rate, for example, in Holland is much higher than France for the same stage. And if you look at the multifactorial variables in primary care, the country comes out ahead of size, grade, and nodal status as to how the patients are managed. On the other hand, there are some consistencies, but if you look within individual countries, there are some inconsistencies. For example, if you live in the west side of Switzerland, then you're much more likely to be picked up at an earlier stage if you've got a cancer than you are on the east side of Switzerland. And that goes back to political decisions that were made in the early 1990s. And there's a lot written about Switzerland in the scientific medical press, because it is estimated that in the east side of Switzerland there are possibly 300 avoidable breast cancer deaths every year. So in other words, if those women had lived in West Switzerland and had then been diagnosed, their outcome would have been better. So that goes right back to the financial, political decisions made 10 or 12 years ago. It's as fundamental as that. If you look at the United States, they spend 15.2% of their GDP on healthcare for about 80% of the population. In the United Kingdom, we spend between 9.5% and 10% for the NHS, which is supposed to cover 100% of the population. Certainly, you will get treatment if you have that need, regardless of insurance or ability to pay. But we can anticipate that that GDP is going to go up in the States. But if you look over the last 6 years, the actual incidence of breast cancer has come down. And it's come down quite dramatically. In 1 year alone, it came down by 7%. And that's not just the fact that women are turning away from using HRT. That probably accounts for half of that drop. And there are other factors that account for the rest. So what we have to do is to look at lifestyle changes and ways that we can influence the promotion of breast cancer in individuals and how you change people's dietary habits, exercise habits, their weight, all of those things are linked into breast cancer risk on a national scale is a big, big challenge. It's a challenge for the politicians. So I see it, firstly, having to reduce the burden of breast cancer in society, but secondly, doing far more sophisticated, more focused treatment for the patients who do get it, and that is going to be very expensive. Message to the patient at the moment is to try and live as healthy lifestyle as you can, exercise regularly during the week, keep your weight within normal parameters, don't overdo it on alcohol, and try and keep your weight steady as you go through those critical years between 30 and 50. Secondly, be very breast aware, and if you have an opportunity to go for screening, take it, because if you do have a cancer, it's likely that it will be picked up when it's small and eminently treatable, and be very breast aware.